Hi, welcome to VCU, and thank you for giving our general surgery program consideration for your training. We're an extremely busy and robust residency that helps to staff 4 different hospitals throughout our training. Our flagship hospital in the heart of downtown Richmond is a level 1 trauma center that sees a relatively high volume of penetrating trauma as well as a vast range of pathology as a quaternary referral center for specialties like surgical oncology, thoracic, transplant, and bariatrics. Our new freestanding children's hospital is just across the street and a primary center for many pediatric specialties in the region. We also have an opportunity to learn bread and butter general surgery at our local VA Medical Center and Winchester Medical Center. All of these facilities expose us to a broad range of pathology and high operative volumes. Each of these facilities has state-of-the-art equipment and provides training in advanced laparoscopy and robotics. During training at VCU, residents have the opportunity to do 1 to 2 years of research between their clinical PGY2 and PGY3 years if they choose. There are various opportunities at VCU and the VA to do basic science and quality improvement research. This decision is typically based on future fellowship possibilities. Most of our residents will go on to match into fellowships in extremely high competitive subspecialties, including pediatric surgery, surgical oncology, and colorectal surgery. However, VCU trains strong general surgeons readily capable of entering independent practice immediately following residency. One of the best aspects of this program is the support among residents, faculty, staff, and program directors. They want you to get into your dream career and to help individualize your experience and give you the tools to do so.
Hi, my name is Hae-sung. I'm the education chief this year. I think the main strength of our program is clinical training. We're always busy taking care of patients and busy operating, and there are no shortages of cases. All of the chiefs this year already met their minimum requirement to graduate, and this was within the first 2 to 3 months of their graduating year. The faculty here are friendly, they're approachable, and they'll let you take care of their patients and also operate. In addition, we also set up people for successful match into any fellowship that you might be interested in. That includes transplant, to vascular, to surgical oncology, to pediatric surgery. In terms of education, every Thursday we have about 2.5 hours of protected time. This is when we have grand rounds, M&M, and didactics as well. SCORE curriculum is what we follow. In addition, we do have mock oral exams twice every year and chief review sessions to prepare us for board certification. Lastly, we have robust curriculum in FLS and FES and also simulation lab. By the end of graduation, you'll be also robust certified.
We see general surgery residents in almost every year of their training, and you'll learn something new every year that you're with us. We see patients with complex colorectal disease, including inflammatory bowel disease, colon and rectal cancer, anal cancer, pelvic floor disorders, and anal rectal disease. While on our service, you will work with us in the inpatient surgery setting where we perform a wide range of open, laparoscopic, and robotic cases. In addition, you will join us in the outpatient surgery center where we do most of our anal rectal surgeries. You will also rotate with us in endoscopy where you will learn to perform colonoscopies. General surgery training is very complementary with colon and rectal surgery. You'll learn to do laparoscopic colectomies, be comfortable in the pelvis, and operate on the anus and rectum. We look forward to having you on our service.
At VCU, residents have the option to go into the lab for 1 to 3 years after their PGY2 clinical year. People do all sorts of things for research, from basic science to translational research to clinical research. People also sometimes go out and pursue advanced degrees, such as masters in public health, and we've even had multiple residents go to other institutions to gain more experience during their lab time. For my research, I'm involved in the 3D printing lab at the VA, so I'm interested in going to colorectal surgery, and so a lot of my 3D printing research is geared towards pre-surgical models for colorectal surgery and surgical oncology. I'm also passionate about surgical education, and so I'm printing 3D models for education of residents, fellows, and medical students. Another great thing about time in the lab is the experience that you can get with moonlighting. So we have options to moonlight at the VA, in the ICU at VCU, at the burn surgery at VCU, or at the Children's Hospital of Richmond. All of those are great learning opportunities, and you can moonlight as you choose during your research time.
Having worked in multiple different hospitals during my training, I can confidently say that the critical care volume and acuity at VCU is unmatched. We care for critically ill trauma, burn, and surgical patients of all types. And as one of the major referral centers in Central Virginia, we see an incredible breadth of pathology. You will also have ample exposure to bedside procedures, including various lines, chest tubes, bronchoscopies, and bedside tracheostomies, as well as gain expertise in critical care ultrasound techniques during your training.
Our GI bariatric service is a very special rotation among the residents at VCU. It's a pretty robust service. Roughly, we see about 400 endoscopies a year. They see 200 minimally invasive general surgery cases, as well as about 350 bariatric surgery cases, including sleeves and bypasses. We rotate through the service as interns and second-year residents, giving us early exposure to some of the more complex, minimally invasive cases. We're also fortunate to have teaching faculty that are well respected in the field, and what's even more important is their emphasis on teaching. We have weekly conferences where we review cases and complications within the service itself, and it gives you a great opportunity to solidify what you've learned in the OR and sort of help apply that to your own individual practice. I really feel like going through those rotations has made me a better resident, and I hope you have this opportunity as well.
Every trainee wants to know about the opportunities to participate in global surgery. I recently completed my 2-year Global Surgery Research Fellowship at VCU. During my fellowship, I had the opportunity to live and work in Rwanda, conducting research, teaching, and streamlining protocols for those working on the ambulance. I also had the chance to work with medical students and surgery residents. I operated with Rwanda's only pediatric surgeon. I later traveled to Ecuador to work with one of our trauma surgeons, Dr. Rodas. I worked with his foundation, Cinturandes, on their mobile surgical unit. I was able to perform laparoscopic surgery and assess patients in the heart of the Amazon rainforest. The following year, I completed my master's in public health at VCU. I was able to present my research at conferences around the world and publish my findings. My experience was incredible, and you can have similar opportunities here at VCU Surgery.
Many of you have already spent some of your training time at a veterans hospital, but as the saying goes, if you've seen one VA, you've seen one VA. So I'd like to tell you a little bit about our VA here in Richmond. Housed in a 1.2 million square foot, 400 bed facility, we are one of the largest and most complex VAs in the country. In addition to a new cancer center, simulation center, and surgical endoscopy unit, we offer complex surgical care spanning 12 surgical specialties. Our cardiac surgeons perform LVADs and heart transplants on site. Our urologists and general surgeons have been offering robotic surgical techniques for almost 20 years now. And we've recently opened programs in surgical gynecology and bariatric surgery to serve our rapidly growing patient base. Though attending surgeons are physically present to supervise all operative procedures and clinic consultations, we strive to give you as much autonomy as possible in order to hone your clinical decision-making, teaching, and leadership skills.
Here at VCU, we get a great and comprehensive exposure to surgical oncology, from bread and butter cases to very complex cases. Downtown at VCU, you rotate through surgical oncology as an intern, 3rd year, and 5th year. As an intern, you primarily do floor work as well as getting exposure to soft tissue cases. As a 3rd year, you help run all the consults, so you see all the consults that come through and then help with a lot of the endocrine cases as well as get exposure to some of the GI cases. As a chief on the service in your 5th year, you primarily do the GI cases, and you get exposed to very complex patients. We have exposure to Whipples and robotic Whipples, as well as HIPEC and cytoreductive surgery. Additionally, you get to rotate on surgical oncology at other hospitals. So at the VA, you get exposure, as well as at Winchester, your 3rd and 4th year.
Here at VCU, residents have the opportunity to pursue 1 to 3 years of research between their PGY 2 and 3 years. As a junior, Dr. Nan meets with each resident to discuss research and fellowship goals and helps map out your research years. At VCU, there are numerous opportunities to participate in clinical, basic, and translational research. We have labs within the surgical department, including a surgical oncology lab run by Dr. Trevino and a cardiac surgery lab under Dr. Cotter. Residents can also work at the VA, which has numerous opportunities, including a QI program and a robust 3D printing program. Residents can also pursue research outside of VCU. We currently have residents in Johns Hopkins, the NIH, and California. Overall, residents are successful during their research years and come out of lab with presentations, publications, grants, and additional graduate level degrees.
Our burn rotation is wonderful. You get to be in the operating room every day and learn how to do pretty complex skin grafts as well as complex wound care, which is always good to have in your back pocket for even other rotations. The attendings really care about our education and are great about including us in all cases, as well as the NPs and nursing are also really critical to our learning experience here. We have a wonderful new burn center, which is pretty state-of-the-art and even has its own operating rooms. So overall, the rotation is wonderful.
The vascular surgery experience in our program is at both the VA and VCU, and we have 8 attendings between the 2 locations. Vascular is a fast-paced and challenging service at VCU for interns who perform basic cases and amputations as well as help manage the floor and ICU. Third-year residents experience truly the full breadth of vascular surgery during an operatively heavy rotation at the VA where fellows rarely go. They fully run the service along with an intern and nurse practitioners, and it's become a favorite rotation for a lot of people. For interested residents, there's also the option of rotating at the VCU service again as a senior resident. Primarily, people who do that are those considering applying for a vascular surgery fellowship. Our program is especially strong in vascular trauma, complex endovascular reconstruction, and complex aortic surgery. We do these cases primarily in the 3 state-of-the-art hybrid operating rooms at VCU that have robotic C-arms with an on-table CT as well as CT fusion technology. A brand new hybrid room is also being built at the VA. Both locations have truly world-class OR and support staff. We look forward to working with you in the future.
We have a phenomenal program here to grow as a confident surgeon and as a strong individual. Our faculty is interested in you as a person and are approachable with any concerns. They understand residency is very challenging, physically, mentally, and emotionally. We're fortunate to have a fun and supportive team of residents, and we regularly go out for dinner to catch up on life. And this includes everyone from chiefs to interns, spouses, kids, and friends. We celebrate birthdays, weddings, and anniversaries as an entire department. If you have a loss in your family or are welcoming a new baby, we coordinate that time off you need to recover and to be with your loved ones. There's childcare available with hours that agree with our busy schedule, and many of our residents and attendings take their kids there. We make sure that you get the time off you need to make sure you get to your health appointments to keep you at your healthiest. If you need mental health support, we find the resources you need. No stigmas attached. We have also created a committee for the development, engagement, and wellness of our entire surgical department to focus on promoting well-being. At VCU, you will work in a cooperative and inclusive environment to become a strong and resilient surgeon.
The VCU Trauma Center is the largest Level 1 trauma center in the region, with over 4,000 trauma activations each year. Patients present with a variety of injuries, including falls, blunt trauma such as car accidents, burns, and with penetrating injuries such as gunshot or stab wounds. Surgery residents serve as the primary evaluators of these patients in the trauma bay, with assistance from the emergency department and anesthesia teams. This gives you the opportunity to develop your rapid evaluation skills, as well as gain experience in procedures such as central and arterial lines, chest tubes, and occasionally thoracotomies. Patients in need of surgical management can be taken directly to the operating room for further treatment, or if more stable, can be taken to our dedicated CT scanner for further evaluation. Our trauma bay is a state-of-the-art facility with 6 resuscitation bays as well as 4 additional rooms that are able to be scaled up to meet the needs of our patients in the Richmond community. Our trauma rotation serves as a strong learning opportunity for both junior and senior surgery residents.
The cardiac surgery service at VCU is a fast-paced, dynamic service that cares for a very diverse patient population. We specialize in complex heart surgery, including mechanical support devices, ECMO, valvular disease, coronary artery disease, total artificial hearts, and heart transplantation. While on our service, you'll be an integral member on the floor caring for patients in the intensive care unit and our outpatient clinic, as well as in the operating room. As a resident, you'll be seeing consults, caring for our daily patients, performing bedside procedures, working in the operating room to learn more about the conduct of cardiac surgery, and helping procure hearts for transplantation. It is our goal to provide you with the opportunity to learn as much as you can about a clinically busy service with exciting surgical operations.
In your 3rd year and your 4th year, you are on the more general surgical side of it, where you get to work with a private practice surgical group, the Winchester Surgical Clinic, as well as the surgical oncologists. This is a very unique experience in the sense that you see the private practice surgery world. And with the surgical oncology group, you get to work very closely with 3 surgical oncologists. During this time, you're able to manage the floors, you're operating pretty heavily, and you really get integrated as part of the team. Outside of that, you're able to live in an apartment that the department provides for you, and there's plenty to do in Winchester, from the Apple Blossom Festival to the rolling mountains nearby, as well as DC about 45 minutes away.
We rotate on the transplant surgery service through the Hume Lee Transplant Center in our first and third years. We also cover transplant call during our weekend and night calls. The service is a highly operative experience for residents with currently 8 transplant attendings. We get exposure to a wide variety of procedures, including liver, kidney, pancreas transplantations, in addition to dialysis access, liver resections, and robotics. As residents, we also get the opportunity to go on procurements, which allows for some of the best anatomical exposure and learning. The rotation has been pivotal in motivating residents for the last 3 consecutive years to pursue a career in transplantation.
Our pediatric surgery experience at VCU is unparalleled to most surgical residency programs with a quaternary level children's hospital for several reasons. First, our pediatric surgery attendings cover VCU and several other community hospitals across Central Virginia. Despite their operative volume, they invest a significant portion of their time in our education and professional development. If you express interest in pursuing a pediatric surgery fellowship, our attendings go out of their way to guide and mentor you in order to be a successful applicant. In fact, our institution has had a strong history of placing residents into a pediatric surgery fellowship. Second, because we don't have a pediatric surgery fellowship program, we first assist on appendectomies to TE fistula repairs, PSARPs, and CDH repairs, not only on children who reside in Central Virginia, but also on international children through our partnership with the World Pediatric Project. Third, speaking from personal experience, our attendings provide us with level-appropriate autonomy in decision-making and in the operating room. Finally, we just opened a brand new standalone pediatric hospital, the Children's Hospital of Richmond at VCU, that is directly connected to our main hospital. Since its opening, our patient and operative volume has increased, and we are excited for the continued expansion of patient care areas throughout the hospital. I look forward to meeting you, and feel free to reach out for any questions you have throughout the match process.
As someone who's not originally from Virginia, I can tell you that Richmond is a great place to live. There are so many different options on living locations. It could be in apartment buildings, converted hotels, old renovated tobacco factories, or historic Victorian homes. You can live in the downtown area and have the advantage of being able to walk to work, which is a fantastic advantage when you've had long nights at the hospital. The other options is that you can live in the surrounding communities of Church Hill, the Fan, the Museum District, or Shockoe Bottom. Lots of different options. And when you're in the city, Richmond has really become quite the foodie town. You'll find all over the city different farm-to-table options where the menus change as the ingredients change, and it always makes an excellent culinary experience. And Richmond has very close proximity to the Chesapeake, so we have some great seafood in our city. You're looking for any kind of cultural activities, we have theaters, we have museums, and it's just an excellent opportunity to see traveling Broadway shows, the Richmond Symphony, the Richmond Ballet, or any kind of musical concert, or even traveling up towards DC and having easy access to big outdoor concert events. Looking for some kind of outdoor activities, the surrounding communities, or even in the downtown area, we have the River City. So you have the James River, you could be kayaking, you could be stand-up paddleboarding, you could be white river rafting, or you could do what I do, which is run along the trails, the islands, Belle Isle, Browns Island, up and down bridges, just an amazing place to live.
Thanks for watching. And there you have it, VCU Surgery, a phenomenal place to train, grow, and live.